thank you very much. It's certainly a real pleasure to be invited to speak to you all today. Without even meaning to, there seems to be a real theme already developing, and it fits really well with my talk too. And it is about inequality, and it's inequality to access, and it's also inequality across the regions of care. So this is why I'm here representing New Zealand Nurses Society, Urology Nurses Society as the chairperson, and I'm also the education lead across Australasia for the Australia-New Zealand collaboration. And one of the things that we've picked up is about preparing nurses to care for patients with prostate cancer, as well as other urological tumour streams. But there's certainly a lot of variation and not much standardisation across both Australia and New Zealand, as well as regionally within our own country. And so this led to us developing a standards of practice framework. So that's what I'm going to talk about. Also going to just give you an overview of the different scopes of practice that we have in New Zealand for nurses. Not everybody's aware of the nuances through nursing training, so I'm going to cover that a little bit, and also about what our professional body statement of purpose is, so how we align with educating nurses and what endorsement or mandate do we have to do that. We'll talk about the Standards of Practice project that has just been completed, the teaching that's currently underway to improve nursing care to patients with prostate cancer, and where our future steps are, and where we've been heading globally. So this is just a summary table of the different scopes of practice that New Zealand legislate. The first one is enrolled nurses. They have an 18-month diploma program that they do, and they specifically work under direction and delegation of a registered nurse. Then we have a registered nurse who completes a 3-year bachelor degree. The practice is very broad. We can have novice registered nurses right through to expert registered nurses working at the top of their scope. And they work independently and collaboratively within the multidisciplinary team, so doctors, physios, social workers, etc. And then right at the top of the registered nurse scope of practice is something called expanded scope of practice that was clearly defined in 2011 by the Nursing Council of New Zealand. And this was in response to nurses advancing their practice and working in areas that were traditionally under the realm of medicine. Nurses taking on various small procedures that used to be done medically. And so the scope of practice had to be expanded for those nurses. They're certainly an advanced practice role. And then we have an RN prescriber. We don't see RN prescribers in urology yet, but there are some in diabetes and chronic medical condition management. They work by a schedule of medications that they're allowed to prescribe, and they have to follow that. So people who fall under these scopes are your clinical nurse specialists, your cancer care coordinators, and they run nurse-led clinics and work under collaboration guidelines and protocols. And then in the far right, we have nurse practitioners. There are 360 of us in New Zealand, and only 3, unfortunately, within urology. So hopefully part of our Standards of Practice project framework will encourage a professional pathway for other nurses to join us as a nurse practitioner. We have to undergo a master's degree. It's clinically focused with prescribing and pharmacology as a core component. And once we've qualified and passed the panel assessment, which is an oral exam down at Nursing Council in Wellington, we become authorised prescribers, the same as doctors. We don't have any limits there aside from Section 29 medications. We have a legal authority then to work beyond that registered nurse scope of practice and can work independently. So this is just an article that was published more than 10 years ago, already talking about advancing nursing practice roles and the need for them within our healthcare. And this is globally, not just within New Zealand, in order to meet our workload demands. As you know, it's harder to get appointments, longer waiting times, and clinician resources more scarce than it used to be with an ageing, growing population. Also, and so this was identified, but we hadn't actually addressed it until now. So now we have So now we had education that wasn't addressed for nurses to be working in advanced practice. They certainly were able to within protocols, within their scope of practice through the Nursing Council, but there wasn't any educational preparation or consistency around that. So these are some other articles that specifically relate to urology and how nursing has advanced. The international literature clearly denotes that these nurse-led clinics have provided extra resource and improved capacity as well as access to assessment and ongoing care. So in 2009, our colleagues across Australia and New Zealand, Trish White, Helen Crowe and Elaine, all did an Australasian survey looking at what nurses are doing within urology and how they are defining their roles. And also remuneration. There was this huge variance in this study demonstrating that some nurses are working under the title of a clinic nurse or registered nurse, but actually providing a far more advanced level of practice, but not getting remunerated for that. And then there were others that were deemed advanced nurse practice roles, but actually working as a registered nurse and not doing those advanced assessment and clinical reasoning. As you can see here, we had 148 nurses who identified as working in advanced practitioner roles. Approximately half of them required some clinical experience within the area, so it's a little bit scary to think that just over half of them didn't. And just over 59% required postgraduate ongoing qualifications and able to undertake this nursing care. So approximately 40% of them weren't. And there were 35 different job titles, and they were all locally designed based on workload and what that service deemed needed. So you can see it's clear as mud. And in terms of doing digital rectal examinations, about 24% of those people undertook them, but actually 20% of them taught themselves and had no supervision or training whatsoever. So oncology surveillance clinics are a large portion of advanced nursing practice roles, and 50% of those were self-taught. So as our professional body, our statement of purpose is to ensure that we aim to promote excellence in nursing care, that it's evidence-based, and that we also network and disseminate the information and try and affect change. So back in 2017, October 2017, the committee, Urology Nurses Committee, undertook a survey of our national body, which is around 130 nurses that are members of our body, asking them what they're doing in their jobs and what educational preparation have they got and what support do they have to be able to undertake their role safely. And that really became the baseline for this project. We realised, though, based on that survey, that this was something that, as volunteers, this was going to be a huge project that required more than just a couple of hours on the weekend each week to do. And so we sought funding for a project leader, and we were very lucky that the Prostate Cancer Foundation of New Zealand supported and funded that role. So Trish White is a urology nurse practitioner in Hawke's Bay. She became the project leader for this and collated all of the information and was responsible for the final write-up and consultation with everybody. So when we consulted with this document, there were many drafts. I think we had 7 drafts in total before our final version. The consultation was across multidisciplinary professions as well as various specialty nursing groups, the Nursing Consortium of New Zealand and Nursing Council. Now, Urology Standards of Practice framework is not new. There are other specialties also publishing specialty standards. These are mental health, cardiology, renal nursing. So we're not, this is not something new that we've made up. Certainly a history behind it. And this document has just recently been published in March. Within the document, for the public to be able to access it, we have included what the different scopes of practice are so that they have a clear understanding of the roles and responsibilities and what they can expect from their nursing care. And also within the table, which I'll show you shortly, there are recommended training alongside each different scope of practice so that there's a professional development pathway for nurses and employers who want to go down this route. Also, as part of this, when we recommend training, we need to also put our money where our mouth is and provide this training so that it's standardised and nationalised, rather than have little study days in pockets across the country that aren't all of the same level. So this is the first table, which shows healthcare assistants which are unregulated and they don't answer to the Nursing Council. But we have enrolled nurses and registered nurses. I appreciate you won't be able to read all of that, but it's within the document, and it just gives you the columns there about what the educational requirements are, what kind of clinical skills you would expect that nurse to be able to perform at that level, and then what training would we recommend and what's out there. Because I'm lucky that I live and work in Auckland, so I have a lot of resources around me and support, and I can ask somebody what's out there. And also we have a lot more senior nurses, but people that work in regions or rurally, they're often isolated and don't have the opportunity or have anybody that they know of to ask about what is out there in terms of their educational pathway. This is the senior nurse pathway here that we've recommended, and that's your clinical nurse specialist working under registered scope of practice or expanded scope of practice, and then the nurse practitioner scope. And again, all the clinical skills and recommended training that goes along with that. As you can see in the recommended training, we've got their workshops. Now, those are workshops that I'll cover shortly. They're national workshops that are covered by the Urology Committee, our Nurses Committee, so that they're all standardised and you can be deemed competent and safe to do things once you've attended them. So what are the benefits of having this framework? As you can see, as you know, we've got limited clinician resource in terms of our urologists, and so it's better utilising the workforce that we have, and nurses are well placed to be able to do these nurse-led clinics with the training and support alongside them. So it means that nurses also, you've probably had the experience where you've gone to see a urologist and he's double booked because he's got lots of different people to see, urgents that he's trying to fit in, he or she I should say, trying to fit in, and they can't always spend that time explaining and educating around different treatment options or medication side effects, for example. So nurses are really well placed to have more time to be able to do this. And liaise with the urologist around any further information or clarification that's required. And then, of course, involving the wider whānau. It means then that our urologists are able to use their skills and knowledge in the best place possible, which is for the higher acuity, more complex patients, and also operating and emergency work. These advanced nursing practice roles mean that we have better waiting times and improved access, and it increases our faster cancer treatment, meeting those programs. Also, of course, nurses are cheaper than doctors, let's face it. So if we can allocate that money elsewhere and have a nurse-led clinic for prostate cancer surveillance, we can allocate that money for those appointments that we've saved for a urologist elsewhere. I know for my nurse-led clinics I did an audit on, and I was saving something like $40,000 a year. So for me, undertaking these advanced roles. So that $40,000 a year could be used elsewhere. And of course, nurses have to have a professional development pathway and a job satisfaction and remuneration that's appropriate. And at the end of the day, all of this is to improve equality of care, equality to access to care, and patient experience. So this was our strategic plan in 2016 on the left that we started in January 2017 when we started our project for the standards of practice. And these were the workshops that we wanted to achieve. And I'm very happy to say that we've achieved every single one of them with our dedicated committee that we have. There is only 10 of us on this committee, and we've managed to undertake every single workshop here, and all of the making sure that all of these are consistent and evidence-based. So where do we head next year? Next year, we're aiming to run further workshops to expand that training so that nurses can work into other areas. So this was our first prostate cancer workshop that we did last year. We were very lucky to have mostly New Zealand speakers. We had Sue Osborne, one of our nurse practitioners, Trish White, our other nurse practitioner, and we also had a guest keynote speaker from London with giving us a UK perspective on what nursing care for patients with prostate cancer was like there. So the content that we covered was an overview of anatomy and physiology, diagnosis and staging of prostate cancer, treatment, both localised and metastatic prostate cancer, cancer survivorship, and then how to set up nurse-led clinics and ensure that you can audit and monitor your practice and ensure that you do actually improve care. So we had 25 nurses from around the country attend, and the evaluation feedback that we had was 100% positive feedback. So we'll be running this again this year in October at our national conference and ensuring that we've just fiddled around with it to get it right, because last year was our first time running it, so we would fine-tuning it for this year. I'm not sure if many of you have heard about a report from the UK called Get It Right First Time. It was a NHS-driven report across 35 different surgical and medical specialties, so not just urology. And it looked at exactly what we're talking about: access to care, quality of care, best utilising the workforce that we've got, workforce planning for the future, cancer survivorship, all of those sorts of things. Interestingly enough, the urology report had 18 recommendations. The top two, now the first two most important priorities were nursing-based. That's astounding when you think about how far we've come. That's a great wave of change, and I'm really excited to be part of urology at this time with all the international collaboration that's going on. The first one that fits so well with what we've been doing over the last 18 months is about developing a structured training program or a curriculum for these advanced practice roles. So little did we know that this was occurring over in the NHS while we were here doing ours. It wasn't until we got to our draft documents that we started collaborating and realised that across the countries we all have the same challenges and we're all aiming for the same goals. The second recommendation was about workforce planning and job planning for CNSs and appropriate skill mixes to be able to meet the needs of our population. So this is the international collaboration that's been happening over the past, since October last year. We have been meeting with the British Association of Urology Nursing, the European Association of Urology Nursing, Australia, Ireland, and Melbourne with the La Trobe University. We've been very successful in negotiating scholarships for Ulster University in Ireland that run specific urology nursing postgraduate education, and that will be becoming available sometime later this year for nurses to apply for. There's also La Trobe in Melbourne University, where there are postgraduate prostate cancer papers, and scholarships are going to be available for these also. So this is going to be open for New Zealand nurses to also apply. Andrea Nixon has been our chairperson for Urology Nurses Society for the past 4 years, and she represented Australia and New Zealand when she went over to the UK to meet with the executive team. The other person on the committee is Kath Schubach. She also went to Europe and met with them. So there's a lot of collaboration going on so that we can all sit at the same table and for the same common goal. So this year we've just come back from Australia, our Australasian conference, and we did our first World Cafe. This was new to me. However, the first World Cafe had been done in the UK, in November 2017, and then in Europe in March. So what this was getting a room of nurses, lock them in the room, put them into 4 different groups, and we gave them 4 questions to answer, and we brainstormed and wrote on the whiteboards. If people didn't feel that they were confident to speak up, they could write little post-its and put them on the walls. All of that information was looking at what would an educational curriculum look like globally? How would we achieve it? Who are the stakeholders? Who do we need to involve? Do we need to involve patients? Do we need to involve doctors? Who dictates or regulates this framework? All of this information has been collated from Britain and Europe. We're going to be collating the Australasian information, and this is going to be published as a global research to help guide our framework internationally. So in summary, it's New Zealand Urology Nurses Society's aim to ensure that the development of advanced nursing practice roles are consistent and educationally prepared well around the country, not just within the main centres. However, there needs to still be some movement around acceptance of nurses working within advanced practice roles in some areas, and accepting nurses rather than a urologist, expecting to see a urologist for all of these things. Because all of these are not in isolation, they're in collaboration, and we never do something on our own. We always work around the guidelines and guidance of our team. So the development of standards framework has a professional pathway now, and to further nurses' careers if they wish to do that. It also means that the public can look these up and have an expectation of what they expect to see when they see these nurses working in these clinics or in these roles. And as Trish was the project leader, I'd really like to just acknowledge her work because she's not here today. She's been a fantastic nursing leader for urology. And of course our wonderful committee. And of course Prostate Cancer Foundation for funding Trish's role in managing to put this amazing body of work together.